and I wish everybody a happy Ramadan, inshallah. Today we are going to talk about who can fast and who cannot fast in Ramadan. And this is a very big question because I think patients quite often insist on fasting. And God said actually fasting is prescribed to you as it was prescribed to those before you, that you may learn self-restraint. And when actually the doctor is faced with the question from the patient who insists on fasting and whether it is safe to fast or not, I think this is a very big decision. Now, Islamic teaching prohibits fasting in any condition in which fasting might harm the health of the patient, increase his pain, or delay his recovery. And we know actually God said in the Quran, Allah intends for you ease, and He does not want to make things difficult for you. We have to remember that Ramadan comes in different seasons and affects actually people in different areas. And if we look at these boxes in black, these are actually from the duration of fasting from 2017, so it is in the summer. While the boxes in gray are those actually from 2001, so that was in winter. And we see actually that in this part of the day, of this part of the world, in fact, there is not much difference in the fasting hours, but look at what happened in North European, that actually fasting hours may actually go up to 18 or 19 hours. And this actually may put a pressure on the patient. Now, the Prophet Muhammad said, peace be upon him, God likes his permission to be fulfilled as he likes his will to be executed. Now, ideally, any patient should have a checkup 1 month before Ramadan, particularly for those who have chronic illnesses like cardiovascular disease, diabetes, renal disease, and so on. And the decision whether the patient can fast or not is left to the discretion of the treating physician. Let's start with diabetes. We've written actually a review article a few years ago, but since then we have seen actually diabetes and Ramadan practical guidelines published in 2017 by the International Diabetes Federation in collaboration with the Diabetes and Ramadan International Alliance. And what they actually say that, of course, that many Muslims with diabetes choose to fast during Ramadan, potentially in some of them against medical advice. Hence, actually, pre-Ramadan assessment is absolutely crucial in diabetic patients to evaluate the risk, to educate the patient, and to make treatment plan with medication adjustments. The guidelines state that with correct advice and support from the healthcare workers, many people with type 2 diabetes may be able to fast safely during Ramadan. Now, the guidelines also state that patients taking sulfonylureas or insulin will need to make some adjustment to the dose and or timing to reduce the risk of complications. And new anti-glycemic medication like the incretin-based therapies, GLP and DPP-4 have lower risk of hypoglycemia, and therefore they are preferable in Ramadan. Patients who are very high risk or high risk diabetics, including type 1 diabetes and pregnancy, need to have a close medical supervision if they insist on fasting Ramadan. Now, the guidelines actually made these risk categories, they divided them into three categories. Category one, I'm sorry, the slide is very crowded, but this is actually from the guidelines. Category one, very high risk patients, those who have severe hypoglycemia within the last 3 months, patients who had actually unexplained diabetic ketoacidosis, history of recurrent hypoglycemias, poorly controlled diabetes, and so on. The category two, which are the high-risk patients, those patients with type 2 diabetes, and they have actually poor glycemic control. The second one, well-controlled type 1 diabetes, even well-controlled type 2 diabetes on mixed insulin, and so on. These are high-risk patients for fasting. And category three, moderate or low-risk patients who are actually diabetic type 2 treated with lifestyle medication, metformin, TZDs, etc. Now, the guidelines also put actually specification for the timing to check blood sugar during the day. And there are 7 times. The first one starts just actually before suhoor or before dawn, early in the morning, midday, in the afternoon, and just before sunset and in the evening. Number 7 is that at any time when there are symptoms of hypoglycemia or hyperglycemia, or when the patient feels unwell. Now, after actually meeting with the patient and making plans, the patient will be advised either not to fast or just actually to allow to fast. Very important statement here is that all patients should break their fasting if the blood glucose comes to below 70 milligram per deciliter, that's 3.9 millimole per liter, or when the blood glucose exceeds 300 milligram or 16.7 millimole, or when the patient develops symptoms of hypoglycemia or acute illness. And if the patient develops hypoglycemia at any time, even a few minutes before the sunset, he should break his fasting. Now, for oral medication, metformin, usually there is no change in the daily dose. The same thing for acarbose, TZDs, and GLPs and DPP-4 in general. Of course, the treating physician will actually look at the patient and adjust his medication beforehand. Now, for sulfonylureas, the guidelines advise to switch to the newer sulfonylureas like the gliclazide and glimepiride. And this is actually to avoid glibenclamide as much as possible. For the SGLT2 inhibitors, no dose modification in general. For the blood sugar and insulin, for insulin doses, I think this is a complicated diagram, and I think this will be left to the diabetologist to adjust that. Now, what about patients with type 1 diabetes? Can they fast Ramadan? This is actually a research which came from the Dar Mina, which is diabetes and Ramadan, Middle East and North Africa study. And there was 136 participants with type 1 diabetes. 72% of them managed to fast at least 15 days, while 48.5% of them fasted for 30 days. Again, there was no significant difference in the incidence of hypoglycemia, but again, the current guidelines do not endorse fasting for type 1 diabetes mellitus. Now, the International Society for the Pediatric and Adolescent Diabetes, they issued actually new guidelines just recently in February 2020 for the young people with diabetes, and they stated clearly that the management of children and adolescents with diabetes during Ramadan is a challenge. It is really a big challenge. And they said that at present time, careful individual assessment and structured diabetes education remain the mainstay of ensuring safe fasting. Now, what about the effect of body weight in Ramadan? We know that we actually now with the lockdown and people staying at home, body weight is increasing in probably most people. This is actually, so we have to be really very careful about our body weight. This is a meta-analysis of over 4,000 participants from 85 studies on the body weight and metabolic syndrome components, and they found that on average there was a weight loss at the end of Ramadan of about 1 kilogram. What's interesting is that this meta-analysis showed that there was substantial decrease in fasting blood sugar, systolic blood pressure, triglycerides, and there was an increase in the HDL cholesterol. Now let's come to the heart, and this is actually an interesting American Heart Association scientific statement, which was published in Circulation in 2017. And it states, of course, that irregular eating patterns are less favorable, while intentional eating with mindful attention to the timing and the frequency of eating occasions could lead to healthier lifestyle and reducing the cardiometabolic risk factor. Now, this is really a very exciting review article published just a few months ago in December 2019 in the New England Journal of Medicine on the effect of intermittent fasting on health, aging, and disease. And look at what it said. Evidence is accumulating that eating in a 6-hour period, within 6-hour period, and fasting for 18 hours. And fasting for 18 hours, it triggers the metabolic switch from glucose-based to ketone-based energy, and this will lead to increased stress resistance, increased longevity, decreased incidence of diseases, including cancer and obesity. This is 10 pages review. I suggest everyone look into it. Now, when we come to the heart, we published the first study on the effect of fasting in cardiac patients. This was a long time ago, a small study of 86 patients, and it showed that 86% of these group of patients succeeded in fasting. And about actually 3.5% could not fast Ramadan. And the conclusion was the majority of patients with a stable cardiac disease fasted Ramadan without significant determinal effects. 1 year later, a group from Emirates, Jassim Suwaidi and others, published actually a larger study of 465 stable cardiac patients attending the clinics. And again, they found that 91% fasted without detrimental effects, while only 6.7% felt worse during Ramadan. Now, a few years ago, we published a review article on the cardiac patient in Ramadan, stating that stable patients with with coronary artery disease can observe fasting in Ramadan. Patients with unstable disease and stable angina or recent revascularization should largely refrain from fasting. The incidence of acute myocardial infarction is not increased in Ramadan, and there was no increase in hospitalization with heart failure. Now, recently, a couple of years ago, a study from Qasim showed that actually in 249 patients with heart failure, 91% managed to fast the whole month, and 92% of them of the patients remained stable. 8% developed instability in their symptoms, and this is attributed to non-adherence to medication and diet. Now, who are the cardiac patients who should not fast? Patients with acute myocardial infarction or unstable angina, acute cardiac illness with serious arrhythmias or myocarditis, recent cardiac intervention, PCI or cardiac surgery, and controlled hypertension, or patients with severe heart failure requiring large doses of diuretics. Group from King Faisal Specialist Hospital many years ago showed that there was no significant effect on the dose of warfarin or safety of using of warfarin in Ramadan fasting. Now we move on to patients with kidney disease. This is actually an interesting small study on patients with stage 3 or higher chronic kidney disease from Riyadh, 65 patients, and they actually looked at, it was done in 2015, and they looked actually at the effect of fasting in these patients. About 1/3 of these patients developed worsening of their renal function, and what we mean by worsening is that there was an increase in creatinine by 0.3 milligram per deciliter. So the conclusion of that study is that patients with stage 3 or higher chronic kidney disease, particularly in the summertime, are associated with worsening of their renal function, and clinicians should warn against Ramadan fasting in this group of patients. Now, this is a review from UK on fasting during Ramadan in people with chronic kidney disease, and states that all patients with the chronic kidney disease should be deemed as high risk or very high risk for fasting. Patients who have mild to moderate chronic kidney disease, stage 1 to 3, may be able to fast. Patients with stable renal transplant may be able to fast. Patients who are on hemodialysis or peritoneal dialysis should not be encouraged to fast. This is actually a clear statement. Now, what about the effect of fasting on renal stones? Does Ramadan fasting increase the risk of developing urinary stones? This is a retrospective study from Riyadh on 237 patients admitted through the ER with renal colic secondary to urinary stones over 10 years period. And the conclusion is that generally Ramadan does not increase the risk of developing urinary stones. But however, when Ramadan comes in during the summer, this actually there was an increase in the risk of developing ureter stones. Now, the second question for the gastrointestinal patients, does Ramadan fasting contribute to the increase of the peptic ulcer perforation? This was published 3 years ago. The largest retrospective study involving 2,300 patients who were operated on due to peptic ulcer perforation in a teaching hospital over almost 37 years. And they found that there was significant increase in surgery for peptic ulcer perforation during Ramadan. And this is why actually they stated in their conclusion, there was really quite a significant rise, was significantly high. Peptic ulcer perforation was significantly high during Ramadan fasting month, and hence patients with acute duodenal or gastric ulcer should not fast. Now we move on to the current COVID-19 outbreak and its effect on fasting. Now there was actually ongoing debate around whether or not adult Muslims should fast Ramadan this year or not, and believe it or not. Does fasting Ramadan negatively impact the body's immunity and cause expansion of COVID-19 outbreak. We know that severe COVID-19 patients might exhibit features of systemic hyperinflammation with cytokines storm characterized by sharp increase in interleukins IL-6, interleukins 1 beta, tumor necrosis factor, TNF-alpha, and interferon. There were also precautions by the WHO in keeping the throat wet during Ramadan. Now, this is actually a nice review article which was accepted in the Annals of Thoracic Medicine. It's not published yet, published by Mu'izz al-Islam Faris and his group from Emirates and other groups. This is actually 23 pages review. And we know actually from a review article published 3 years ago in this journal that fasting in Ramadan reduce the TNF-alpha, reduce the interleukin 6, and reduce the interleukin 1 beta, reduce CRP, and increase macrophage activity in addition to other effects. Now, this group of investigators, they actually produced a research in 2012, a small study of 50 healthy volunteers. They measured the interleukin 6, interleukin 1 beta, and TNF-alpha before and at the end of Ramadan, and they found that all these cytokines were significantly lower during Ramadan, which is really good news. Now, this is a very good review article, systematic review of 45 studies published 3 years ago. And the conclusion is that fasting Ramadan was associated with mild transient change in the immune system, which returned to basal level at the end of Ramadan. And in cardiac patients, there was alleviation of the oxidative stress. Not only that, in asthmatic patients, Ramadan fasting does not alter immunologic parameters. Even in patients with HIV, Muslim patients, fasting Ramadan with HIV was shown to be safe. And in patients with autoimmune disorders, also Ramadan was generally safe. Now, this actually put the conclusion that the false claim that there is a possible adverse effect of fasting by increasing the impact of COVID-19 on the immune system is nullified. Now, Ramadan fasting was also shown not to be harmful on the mucociliary clearance in the bronchi. There was no available evidence that Ramadan fasting is associated with dehydration, no detrimental effects on health attributing to negative water balance during Ramadan month in healthy subjects. Of course, this is done on healthy subjects, not in patients with COVID. Patients with COVID, of course, they are patients, COVID-19, and they should be considered like the patients. Of course, they are allowed to break fasting without any question. Now, the conclusion from these data is that no adverse effect of fasting on the immune system, and this refutes the claim adverse impact of Ramadan fasting on immunity. And as I said, this actually will be published soon in the Annals of Thoracic Medicine very soon. Now, what about the effect of obesity on immunity? There was actually good evidence that obesity and metabolic syndrome impose a significant impact on the pathogen defense and immune function, and these changes are associated with adverse effects on the immunity from infection. This is from 2016 study. Now, recently, actually, in Nutrients 2019, it was stated clearly in a review article that overabundance of macronutrients and calories, that what is involved in our modern diet, can lead actually to reduce control of infection and increase inflammation. On the other hand, it was shown that ingestion of fruits high in polyphenols, carbohydrates, and metabolites effectively cause enhancement of the antiviral and oxidative capacity. So that's what we should actually pay attention to in Ramadan. Try to cut down on these and try to eat more of the fruits and vegetables to enhance our immune system and keep it safe. And again, the same thing for all these drinks and snacks and so on, and to actually encourage ourselves to have more of these nice fruit juice. Now, what about actually the effect of sleep in Ramadan? This is a meta-analysis of 24 studies involving 646 participants, young participants, mean age 23 years, and it showed that the total sleep time decreased from 7.2 hours before Ramadan to 6.4 hours. Although we know that there are people who actually sleep a lot in Ramadan, unfortunately, and that actually should be discouraged. So this is actually what we should do in Ramadan. We actually should make an opportunity for better life with weight loss, better dietary habit, and stopping smoking, and try to do any kind of exercise at home, even actually some light exercise, but I think we should keep ourselves fit and healthy. Now, the last section actually for fasting and pregnancy, and what is the effect of fasting in pregnancy and on the newborn. There are some conflicting reports, but I think I will just show what is available. This is a study which was published a few months ago in October 2019, a study on 78 births of Arabic-speaking women in Quebec. And that actually involved a retrospective study going back, involving actually 36 years. And what it showed that actually fasting during Ramadan between week 15 and 22 of pregnancy was associated with 1.3 times increased risk of very preterm birth. And what's meant by very preterm birth, 28 to 31 weeks delivery or pregnancy. And if it is actually Ramadan fasting came between the 22 and 27 weeks of pregnancy, fasting Ramadan will even increase actually the risk of very preterm by 1.5 in general. Now, there is actually another study which actually showed that in population, this is actually a study from the Netherlands, and again, retrospective study in over 10 years, looking at the records of people from the Mediterranean, and as a proxy, they considered Muslim, 140,000 births during that period. And they found that actually the conclusion, the occurrence of Ramadan during pregnancy among Muslims was not associated with altered birth weight, gestational length, or perinatal mortality. Again, another meta-analysis of 22 studies involving 31,000 pregnancies. Again, there was 19,000 pregnancies exposed to Ramadan. This is a total number, and these are the Muslims who were fasting Ramadan. And again, the birth weight here was not affected in these studies. Now, again, we have actually to respect our International Baby Food Action Network, which actually produced the policy statement just actually last year on fasting of pregnant women and breastfeeding mothers. and they actually called upon midwives, physicians, and nurses to recommend against fasting for pregnant women and breastfeeding mothers during Ramadan, as it could put health hazards on their babies. This is actually the recommendation, and what they said, that healthy pregnant women who are willing to fast, they should follow up with their healthcare providers throughout Ramadan to ensure adequate fetal growth. And if Ramadan coincides with summer, as it is nowadays, pregnant women are advised to hydrate and consume nutritious food during the evening meals. Now, again, so I will stress this, that this International Baby Food Action Network, this actually body produced this statement against fasting for the pregnant and breastfeeding women. Now, we should not forget our colleagues, dental colleagues, and this is actually a review article published a few years ago, that dental extraction can be carried out for immediate pain relief without violating the patient's fast if preventive measures such as high vacuum suction tips are used. We have to remember that swallowing of the blood will invalidate the fast. Administration of local anesthetic will not invalidate a person's fast. So in conclusion, ladies and gentlemen, although the Quran exempts the sick people from the duty of fasting, a significant number of patients with chronic diseases insist on fasting, despite advice to the contrary by their physicians. With the correct advice and support from the physician, many patients may be able to fast safely during Ramadan, but this is very important to again emphasize that the decision will be left to the discretion of the treating physician in these patients. And with this, I will stop here and thank you very much indeed for your listening. Thank you very much. Any questions? This is a question from Dr. Faiz Bukhari. The increased risk of preterm birth in the Canadian study from the CUPIC hazard ratio is 1.5. Why the p-value for the hazard risk is, what was the p-value for the hazard risk significant? Yes, it was significant. And this is actually why they warned against actually fasting in these patients. Yes. Any other questions? Okay. Well, if there are no questions, I think I would like to thank everybody and would like to thank Dr. May Abu Saud, Dr. Adila Qattan, and everyone, and Dr. Hadeen Al-Sini, who actually helped in the arrangement of this session. And I would like really to thank everybody for listening. Thank you very much indeed, and God bless you.